You have codes for all of these conditions. So please figure out the type of anomaly the patient has and you can easily arrive at the right code set. Let's move on to the other vascular disorders called as aneurysms. Aneurysm means an abnormal dilatation of the vessel, where the artery becomes abnormally dilated. We have another type called as a pseudo-aneurysm, in which case it is a type of a false aneurysm in which what happens is there occurs a kind of dissection. So we also call that as dissecting aneurysms. Coming to the aneurysm repair, this is a life-threatening because anytime the vessel can rupture. So you need to know whether this aneurysm is a ruptured aneurysm or a non-ruptured aneurysm, and this can take place in any part of the vessels like arteries. Any artery can be affected with this. When the provider is going to repair such kind of aneurysms, go and see which vessel is being affected so that you can select the appropriate code.